Welcome to Marijuana 101, an education course for teens and adults. Marijuana 101 is made up of 6 lesson modules and can be completed in about 3 hours. Optionally, some students may receive a short electronic follow-up about 30 days after completing the course. Both the student and administrator receive immediate email notification of course completion.
Marijuana 101 provides updated information regarding physiological effects, health issues, and positive-negative impact from chronic use of marijuana. Marijuana 101 opens with an eCheckup to Go survey in Lesson 1. This intervention was created by our eCheckup to Go partners at San Diego State University. The third millennium student begins by entering confidential information and receiving feedback about their marijuana use. Questions about expenditures on marijuana, alcohol, and cigarettes provide a reality check for the student. We ask, what do you like about marijuana? And what are some not so good things about marijuana? An awareness of consequences is important, whether it's difficulty sleeping or not getting things done. We also ask self-reflective questions and allow the student to present their own arguments for change.
At the conclusion of each lesson, we provide a review quiz that must be completed before advancing to the next lesson. Marijuana affects each user differently, and for many people it produces a feeling of euphoria and relaxation. Other people who try marijuana don't enjoy the experience. The user may not like the way the drug makes them feel, or the smoke may be too harsh on their lungs, or the person just doesn't feel safe. Some users may experience even more adverse effects like panic, anxiety, or paranoia. Marijuana is filled with hundreds of chemicals, and when it's burned, hundreds of additional compounds are produced. The THC compound in marijuana has shown to cause problems with memory and learning. Marijuana smokers can have many of the same respiratory problems as tobacco smokers, such as daily cough and phlegm production, more frequent acute chest illness, and a heightened risk of lung infections.
There are ongoing debates about using marijuana as medicine. Marijuana has shown to have therapeutic value as an appetite stimulant for AIDS patients, in treatment of nausea for cancer patients, and control of spasticity in multiple sclerosis patients. Research has shown it's difficult to remember key concepts and facts while under the influence of marijuana. Marijuana use also contributes to on-the-job accidents and worker compensation claims. In one clinical study, long-time heavy marijuana users had substantially lower income and less education than people who smoke marijuana occasionally or not at all. Marijuana impairs reaction times, coordination, depth perception, and tracking skills. Over 11% of traffic fatalities test positive for THC, the primary psychoactive chemical in marijuana. Consequences of marijuana use extend beyond the workplace or classroom. In most states, marijuana DUI charges will result in the same type of penalties. Usually these type of DUIs are seen as identical to alcohol-related DUIs and are treated with the same range of penalties.
Lesson 6 provides information for individuals who want to reduce or quit their use of marijuana. Throughout Marijuana 101, we include recorded and unscripted segments with young adults. In this lesson, we ask how marijuana affects relationships with friends who don't smoke.
Do you think it affects your relationship with your friends who don't smoke?
Yes, I do, a lot. Especially when people will quit smoking, it's kind of like you don't have that same common ground anymore. Like, we're here together hanging out, but you don't smoke anymore.
Also, if you do smoke and some of your friends don't smoke, they're probably not going to want to hang out with you while you are smoking. They're probably going to go do their own thing. You might lose ties with those people because you do smoke.
We also provide some first steps for the person who is considering change. For example, avoid situations where marijuana is present or I'm likely to use. Set a limit on the amount of marijuana I use. Keep a record of my marijuana use. Spend time with friends who don't use marijuana. Talk with someone about my plan to change my use. At the conclusion of Lesson 6, the student completes a course satisfaction survey and must satisfactorily pass the post-test. Upon successful completion of the post-test, The student has immediate access to their certificate of completion. Even after the course is completed, the student still has access to their quiz grades, references, and eCheckup to Go results. This concludes our presentation on Marijuana 101. For more information, please visit our website at www.thirdmillclassrooms.com.